So what is neuropathy? And so just to let you know who I am, I'm Dr. Wyman. I'm a survivor of neuropathy. I had the whole left side of my body with tingling in my hands, weakness, joint pain. I had burning in my legs. My toes and my feet would go numb. My heels would hurt when I walked. I had severe pain in my groin. I was misdiagnosed with MS because every doctor kept telling me, you're healthy, you're fine, you're the healthiest person we know. And I was like, I'm very sick. And so when it comes to neuropathy, I want people to understand it's nerves that are damaged outside your spinal cord. I've treated people with the face, I've treated people with their hands, I've treated people. Feet are most common because of the blood flow that's away from your heart is farther down, and so the nerves get more damaged. And what happens is it's these very tiny, tiny, tiny blood vessels. It's not the big blood vessels. It's not like they're doing a sonogram or ultrasound. It's literally the blood vessels that are wrapped around the nerve that is damaged. And what gets damaged the most is what's called the small nerve fibers. It's not the large nerve fibers. And when they do an EMG, they're testing the large nerve fibers. So I've had people get an EMG, the doctors say they're fine, and I'm like, but you have numbness, you have tingling. That right there just tells me there's a nerve. Because if you have numbness, that tells me all the sensory nerves that tell us your feet, that feeds you information, the pressure nerves, the vibration nerves, the hot, the cold, all these deep tendon nerves, they're all damaged is what numbness means. And if you get burning, that's a branch of the nerve. If you get tingling, that's a branch of the nerve. And so all these different things, and this is where people get leg cramps because they have more damage in the whole nerve circuit. And then people don't also realize is the nerves at the bottom of your feet, they also go to your bowel, your bladder, and your sex organs. So you can have damage there. That's what happened to me. I had constipated for 10 days, peed all the time, and actually had erectile dysfunction. And that's all better now. And when people don't realize that's all tied in, I had a colonoscopy thinking that's part of the problem. And when I healed the nerves and I healed the inflammation in my gut, everything got better. Even my heart rate, I used to hurt. I used to have ear pain and head pain. That all got better when I healed the inflammation. And people don't realize we have to heal the body as a whole. And that's what we do here at our clinic is we look for what is the full problem with your body. I've had people come from Mayo Clinic and Cleveland Clinic and Barnes Jewish, Iowa City, you name any hospital that does a lot of tests, and all they've ever given the people is drugs. I do my tests, I'm like, oh, we can heal the nerves. Like Lee I just worked on today. She's diagnosed with complex regional pain syndrome after her surgery. She's on a walker, couldn't wear shoes or socks, so now we got her wearing socks and shoes because your sensory nervous system, when I'm wearing these clothes, my body has to take in that information and do something with it. Well, when the nervous system gets damaged, it's trying to reprogram that neurology. And protection mode gets kicked on, fight or flight, in our brain, and it saw the socks and shoes as damage and trauma. So the brain's telling her, I don't like this touch receptors, I don't like this. And that's what's happening at the bottom of your feet. When your feet feel like you're stepping on socks or wool socks, feel like they're bundled up, it's because the sensory nerves are damaged. There's very specific nerves that get damaged, and we know how to test them. And we have a very good success rate on getting people's nerves back to where they're supposed to be. So if you've been told that your nerves can't heal, you can't heal neuropathy, that's not true. I've had a girl from St. Jude, Jillian, who I helped, who was told she would never walk, and she walks now. From Lee, who was told, just do some shots and keep getting more pain shots and keep going to the pain clinic. And so nerves can be healed. And what we do at our clinic, because I had neuropathy, is I went and learned how do we heal nerves. The joke is I'm a nerve nerd. We want to get your nerves back to where they're supposed to be. And if you give the nerves what they want, which very commonly is blood flow, stimulation, and nutrition, and we have to get rid of the inflammation to do those things, the body will heal. And there's some other layers I look at why the body's not healing from blood flow, stimulation, and nutrition. Those are the three major things. If we go from there and we keep it simple, the KISS model, keep it simple, stupid, we get people better. And that's how I look at everything, because most things out there are let's cut it, let's burn it, and let's drug it. And that doesn't fix the nerve. And nerves can be healed. So that sounds like you. Our clinic, 1 Degree Functional Health. This is why I do what I do. And the name of the office comes from a Bible verse, but it reminded me if I just could get 1 degree better every day, those 1 degrees would add up. And I'd be in a totally different place than where I started. And that's where the name of my office comes from. 2 Corinthians 3:18. And so I want you to get your hope back, your health back, and your happiness back. That's our mission here. So if you want to find out more, click the link, give us a call. We'll do everything we can to see if we can take you as a patient and see if we can help you get back to where you want to be. Have a good day.